Hello, everyone, and welcome back to your Total Health TV. If you are just joining us, you're welcome. If you are a returning subscriber, then thank you for staying with us. Today, we'll be talking about a very common topic, but is not usually being talked about, especially in this side of Africa. We'll be talking about dementia and some important things to note about this illness. There are four major types of dementia, which is the Alzheimer's dementia, also known as the Alzheimer's disease. There is the vascular dementia, there's the Lewy body dementia, and also the frontotemporal dementia. The Alzheimer's dementia makes up about 50 to 75% of all dementia cases, while the vascular dementia takes up about 20 to 35% of all dementia cases. The Lewy body dementia makes up about 10 to 25% of all dementia cases, while the frontotemporal dementia makes up about 10 to 15% of all dementia cases, making it the rarest type of dementia. So we'll be talking about these types of dementia, how to care for people with dementia, and I believe you are going to really learn a lot from this video. So please stick around to the end of this video so that you can have a full grasp of what we are talking about. So firstly, I'll be talking about the Alzheimer's disease, which makes up about 50 to 75% of all dementia cases. The Alzheimer's disease is characterized by some kind of changes in the brain that leads to the deposit of some certain types of proteins. This makes the brain to gradually shrink, and then the brain cells eventually die. It is the most common type of dementia. It's a gradual decline in memory, thinking, behavior, and social skills. What happens when an individual has Alzheimer's disease? There are usually 5 early warning signs of the Alzheimer's disease. So we'll be talking about these 5 early signs so that you can easily recognize it when you see it. So the 5 early signs of Alzheimer's disease includes: number 1, poor judgment. People with Alzheimer's disease tend to have a poor sense of judgment when it comes to some certain situations, and also they suffer memory loss. They just forget things. They can forget time, they can forget people, they can forget people's names, they can forget events, they can forget so many things. And it's not really their fault, it's not their fault, it's just because of what has happened to the brain cells, as I explained earlier. Another early sign of Alzheimer's disease is confusion of time and place. We can be in the morning and they will think that we are in the night. We can be in the afternoon, they will think, oh, the day is just breaking. So people with Alzheimer's disease tend to confuse time, they tend to confuse places. They can be in the room and they will tell you they're in the bus stop waiting for a bus. So it could be as severe as that, and it can be very, very minute. They can forget people's names, and they might actually know you but not remember your name. Some might not even remember who you are, and that can really make you feel very uncomfortable around them. Another early warning sign of Alzheimer's disease is mood changes. Because of what they are passing through, some of them can get agitated, some of them can get really angry with the situation. Why am I not remembering people's names? Why can't I remember where I was coming from? Oh, I just entered the toilet, now I don't know my way back. That can really get them very angry. So when you say things like that, it's actually an early sign of the Alzheimer's disease. So their mood can change. They can move from being very active and then they just withdraw to themselves. They become very withdrawn from social activities for different reasons. So their mood can change in any direction at any point in time. The last sign I want to talk about is that people living with the Alzheimer's disease, they find it very difficult to complete tasks. They find it hard to complete tasks because of all the changes that have gone on. Some of them because of not being able to remember things. They may not even remember the process of what they are doing. They might forget, maybe a step in the process and find it very difficult to complete that. Because they cannot think very straight, it can be very difficult for them to, put things together as they really want to. So these are the 5 early signs of the Alzheimer's dementia. So now we'll be talking about the other type of dementia, which is the vascular dementia. Vascular dementia affects about 20 to 30% of people living with dementia. So it's also quite common, but not as common as the Alzheimer's dementia. Unlike Alzheimer's disease, because in Alzheimer's disease, we really don't know the exact cause of the dementia. We just know that it's as a result of some changes in the brain that leads to some protein being deposited and causing the brain cells to shrink, and sometimes the brain cells eventually die. But in the case of vascular dementia, the exact cause of a vascular dementia is known, and this is the cause. Vascular dementia can happen when blood flow to the brain is reduced, and this damages the brain cells. This can develop as a result of a blockage in the small blood vessels inside the brain. So even just a single stroke or a series of mini strokes can actually result in vascular dementia. So vascular dementia can lead to slowness of thought, concentration problems, personality changes, and memory problems. The symptoms can be similar to Alzheimer's disease. It also generally gets worse over time, but some medications can slow down the condition's progression. So even though it's similar to Alzheimer's disease, it's not Alzheimer's disease, but it also gets worse over time, just like Alzheimer's disease. There are some medications that can actually slow down the progression of this disease into getting worse. So now let's talk about the Lewy body dementia. The Lewy body dementia is a disease associated with abnormal deposits of a protein called the alpha-synuclein in the brain. This alpha-synuclein, this can also be called Lewy bodies. So when this protein called Lewy bodies are deposited in the brain, it results in what is called the Lewy body dementia. The most common symptoms of the Lewy body dementia include changes in thinking abilities, movement, sleep, and behavior. The common symptoms include trouble with attention, trouble with planning, trouble with multitasking, doing different things at the same time, and also they have trouble with problem solving and also have trouble with reasoning. And so this eventually affects their thinking, their memory, and their movement. This is what is seen in what is called the Parkinsonism, the Parkinson's disease. So, they have trouble in controlling their body movement. You can see them shaking, finding it difficult to grasp things. This is an example of, this is like a symptom, this is like an example of a Lewy body dementia. So lastly, we'll be talking about the frontotemporal dementia. This is the least commonest, like it occurs rarely, and it takes about 10 to 15% of all dementia cases, so it's not very, very common. It's an uncommon type of dementia that causes problems with behavior and language. It affects the front and sides of the brain, which are the frontal and the temporal lobes. This frontotemporal dementia is caused by damages to the neurons in the frontal and the temporal regions of the brain. And so this is the cause of the frontotemporal dementia. So what happens with these people is that some of them, they usually have problems with the language center, they have problems with speaking and writing, and it's usually associated with a motor neuron disease. So they're having problems with speaking, they have problems with writing, they have problems with their behavior, you begin to see all kinds of behavioral variants, and because their motor neuron is usually affected by this disease, by this illness. So these are the four major types of dementia. Now I will just talk briefly about caring for people with dementia. If you have somebody close to you that has dementia, how do you care for them? Considering the fact that a lot of things might be going on with them, they might be finding it difficult to express themselves, they can be very agitated, they can be depressed, different mood swings and memory loss, difficulty in performing tasks. How do you help them? The first thing is that when you are trying to help somebody that has dementia, you need to be very, very patient. You need to be calm with them. They are going through a lot and they don't need somebody that will aggravate what they are going through. If they are telling you that, oh, they feel like they are in the bus stop and you cannot just convince them that no, this is a room, then just play along with them, sit down with them there as you know, something like you waiting for the bus together, and then find a way of distracting them. Bring up topics that will interest them, and then before you know it, you divert their attention from that place into something else. And before you know it, you are able to divert their attention and take them back to where you want them to be. When they're having problems with remembering names, tell them again. If they're asking you for the 10th time in that day what your name is, just tell them. Understand the fact that they cannot remember and it is not their fault. So be happy to tell them, be happy to help them out. When you find out that they're having difficulties with performing tasks, offer your help. Don't make it look like, oh, I know you can do that. Don't make them feel like they cannot do it. Just, render some help. You can give them some simple task for them to actually feel like they are needed and they are useful. But don't make them feel like you can do that. And when they want to go somewhere, for example, they want to go to the toilet, they might not know their way back. You don't necessarily have to rub it in that, oh, I have to take you there because I know you won't know your way back. No. Oh, let me go with you. Can I just, accompany you? Can even say something like, oh, I also want to use the toilet. And then you go with them when they are done and just walk them back. By that, they don't feel that gap in interaction with you. And also when it comes to discussing things, when you are talking about things that happened recently and they have this memory loss, maybe they're not remembering something that happened recently and they're remembering something that happened in the last 10, 20 years. You can bring up discussions that's is centered around that time and they can flow with the discussion. So they are able to interact with you socially. They don't really feel left out of what you are talking about. So you bring up matters that they can relate with, bring up matters that will make them feel inclusive in whatever is going on. By that, they will not be withdrawn socially to themselves and feel like, oh, I'm not I'm not included in whatever they're talking about. Encourage them in discussion, bring up conversations that they will understand, bring up conversations that they will be able to feel like they're a part of it, and that will really help a lot. Then another thing is that in the house where they live, you can do some modifications. Make sure that there is lights everywhere, adequate lighting, so that they are able to watch their steps. They don't, miss their steps and have falls. So you want to prevent a fall as much as possible. You want to prevent that accident. Please make sure that the environment is well lit. Make sure that the floors are not slippery. If you need to get them non-slip shoes and socks, and maybe put some things on the floor that's non-slip materials on the floor so that they don't miss their steps and fall. Another thing that is very important is that in addition to the fact that you maintain adequate lighting on the environment, you can put some stickers that will make them like sign writing, signposts, something like that. That will make them know this is the bedroom, this is the toilet, this is the room, this is the dining, this is the kitchen. Let it be bold enough for them to see, and also let it be against a contrast background so that it will really, really be catchy to their eyes. So make it bold for them to be able to read, like, okay, this is where this is this place, this is that place. And also let it be against a contrast background. Let everything in that house have contrasting colors, maybe like um you know putting things on another surface. Let the colors be contrast so that they will find it very easy to see those things and also to locate them. Most importantly, you need to be really, really, really understanding. We need to be very, very understanding, very patient with people that are suffering from dementia. Don't exclude them from the society because they are part of us. It's not a normal process of aging, but it happens. It happens in many situations. It happens to many people, happens to many individuals, and so they don't have to feel left out of being a part of the society. So I think with this, you've been able to learn one or two things about what dementia is, how to care for people with dementia, the kinds of dementia. Remember the early signs we talked about. So in case you see anyone around you that you think, oh, this is looking like dementia, you know exactly how to help them out. Don't feel irritated when they're asking you your name for the 20th time in 2 hours. So don't feel irritated when they're asking you some certain questions and you believe you've answered before. It might just be that they need you to remind them. And also, you can always try to reorientate them to things, to people, to places. You can use pictures, photographs to reorientate them to people. You can use the calendar to reorientate them to time, events that reorientate them to places. Just make sure that you try as much as possible to have them included in the normal activities of the day, and everybody will be fine. So let's just try as much as possible to support them, to encourage them, and make them feel inclusive in the society. Thank you very much for watching. I believe you've learned one or two things from this video. Please, if you have learned anything at all from this video, look below you. You see the subscribe button. Click on the subscribe button. Click on the like button, and also click on the notification bell so that you are alerted when another video is uploaded. Until we see again in the next video, please stay healthy.